and there are 7 regional prevention coalitions in Rhode Island. They are made up at the local level of municipal coalitions. And what a community coalition is that's a coalition of at least 6 sectors of our communities, and we come together to look at what the substance abuse problem is in our community, and I'll talk a little bit about how we do that in a moment. But we look at the substance abuse problem in our community and then put in evidence-based programs and practices and policies to address that substance use in our communities. So as I said, there are 7 regional coalitions. And it's important because what we're trying to do is we're trying to improve behavioral health through implementation of evidence-based programs. So why is prevention important to start off with? Prevention is really important because we know that at least 12% of high school students report having a substance use disorder. We know that early substance use can impact brain development, and we know from science that a young person's brain is really not fully developed until about the age of 25. So those are really some of the main reasons why we try to address substance use in our communities. So as I said, we talk about bringing together representation from our communities on our coalition. So what we try to do around the table is have parents, we try to have young people, law enforcement, faith leaders, business leaders, school officials, whether that's student assistance counselors or administrators, superintendents, somebody from local government, so that might be a town council member or state representative, and bringing all those different voices together to really understand what is happening at the local level. So how we try to understand that is through what's called a needs assessment, and we try to collect data. So we collect data from the students themselves. They take what's called the Rhode Island Student Survey, and they report on their own substance use and their own perceptions of risk and harm. We also conduct focus groups, and we do key informant surveys. So really talking to decision makers in our community and how they understand what the challenges are around substance use. And then we look at what the risk and protective factors are in our community. So what a risk factor is something in a young person's life that might make them more likely to engage in substance use. So a risk factor might be something like having a parent who has a substance use disorder. And then protective factors are those things in a young person's life that help them to not use substances. So it might be engaged with student assistance program at their schools, or involved in things like sports. So those are some of the risk and protective factors, and there are many of them that we are looking at. And then we try to, as I said, put in place evidence-based programs into our communities. So an evidence-based program is a program that might educate a young person or change the behaviors, and it's been proven to be effective over time in different communities. That's what makes it an evidence-based program. So that is a very quick whirlwind tour of what the regional prevention coalitions are in Rhode Island. And if you'd like to find out more about the regional prevention coalitions, please visit the website, riprevention.org, or check us out on Facebook, RI Prevention Coalitions. And we'd be happy to be a resource. And please get involved because we need everybody's voice at the table. Thank you.